the Health Matters on the Medicine Box. I'm your host, Ekta Batra. Today, we are diving into the crucial topic of children's health. India boasts of one of the largest populations of children, with approximately one-third of its population under the age of 18. However, child health in the country presents a complex scenario. On one hand, while there have been improvements, significant challenges persist. For instance, 7.7% of 43 lakh children in India suffer from malnutrition, with 14 lakh severely affected. Malnutrition leads to stunted growth, wasting, and being underweight. Today, approximately 36 out of every 100 children under the age of 5 are stunted. 19.3% of children suffer from wasting, and 32% are underweight. Rural areas bear the brunt of these issues. Conversely, urban areas face different challenges. India has the second highest number of obese children after China in the world. By 2030, projections suggest that India will have a staggering 27 million obese children, signifying that 1 in every 10 obese child globally will be from India. Additionally, screen time. Addiction is growing in screen time, with 42% of children under the age of 12 spending 2 to 4 hours daily on smartphones or tablets, leading to vision abnormalities and abnormal BMI in a significant portion of school children. Furthermore, post-COVID-19 respiratory ailments like coughs, colds, and asthma are on the rise due to pollution and environmental factors. Cancer and mental health issues also loom large, with India accounting for a substantial portion of pediatric cancer cases and a concerning percentage of students experiencing anxiety and depression, yet seeking professional help remains low. Today, we are privileged to have two esteemed pediatricians, Dr. Rahul Verma and Dr. Anupam Sibal, joining in to delve into these pressing issues faced by children in India. Let's explore and address these challenges together. Welcome to the show.
The oil massage was done as a touch stimulation. So we need to gently do this, not just rub the baby all over the place.
There's a group of children where they have a higher incidence of reactive airway disease. There's a history of asthma, allergy in the family, and that predisposes these children to get more attacks.
There are lots of illnesses like even Tourette syndrome, where a child has tics, where the parent thinks this is just attention seeking.
We are really dealing with a very serious problem of obesity, which is going to have an impact on their blood pressure, their lipid profiles.
I'm going to break up the show for the ease of discussion into infancy, which is 0 to 1. Then I'm going to move to toddlers and preschoolers, which is from 1 to 5 years, 6 to 12-year-olds, and then 13 to 18-year-olds or teens. Well, Dr. Verma, I'm going to start with you about infancy.
Sure.
What are the key problems which are faced by newborns today, which you see in your practice?
So I think one of the most important set of factors immediately is the fact that we now have a good incidence of prematurity coming up. In the past, I suspect we did have the same numbers, maybe a bit less, but the survival was not so certain at that time. Today, with advancing science, more experience, the survival of these preemies now is obviously on the uprise. And obviously with that are the possible side effects of prematurity itself. So that is a very important issue. The other thing is, though we say prematurity accounts for hardly 10 to 15% of all our babies, low birth weights or small for gestation age, I'm going to use them interchangeably because we are at a decent common level of education. That incidence is quite high. So that's as much as almost 15 to 25%.
One of the key things that we see in newborns is the traditions that we follow in India. So there are practices which range from massaging with oil every day, sometimes too vigorously. Sometimes it is, applying besan to lighten the skin, to remove the hair, and even mustard oil in the ears if in case there is a earache. What do you recommend when it comes to these kind of traditions?
So our medicine, actually ancient medicine, was pretty robust. And I think the reasons for doing or carrying out these practices have actually gently been corrupted over the ages, where we do not understand the primary reason why something was done, or more importantly, how it was done. So oil massage is definitely good for babies, there's no doubt about that. But the way we do the oil massage is very important. So if we are going to try to get the upper layers of the skin and the hair off the baby, it's a traumatic experience for a baby. And that is not the reason why we do oil massage. What is important to understand is the oil massage was done as a touch stimulation. So we need to gently do this, not just rub the baby all over the place, but gently move our hand, caress the baby. And the oil is to be used only as a lubricant, no, not as a removal agent, which we normally see. Second thing is, of course, over the time period, the people doing the oil massage are different now. So I always put up an example that the lady who does the oil massage comes from a lower socioeconomic standard, living in challenging circumstances, not trained except by pure experience. Zero knowledge, but pure experience in conducting the oil massage. So that obviously is not going to be as positive as a member of the family, herself or himself, doing the oil massage gently. We love our children, we are not going to hurt them at all. While it's set in the mind of the professional masseurs, as I would say, is that you need to rub the baby through and through at whatever be the circumstance. So that was one thing. Which oil to use? I think that's a huge challenge. So we've gone from coconut oil to groundnut oil to mustard oil also. Not only in the ears, the same oil is applied all over. Many of these can be pretty caustic actually. So they can actually create problems for the baby. The hygiene and cleanliness of the oil itself is also challenging. If it's unclean oil, then obviously it's going to create a problem. So besides an allergic reaction to the rather acidic oil, I would say, or to the intense oil, as I would put it, it's also going to be a question of hygiene of using that oil. And oil is a good substrate for bugs. So if it remains on the body for too long or is stagnant for too long in bottles, the risk of skin infections would increase in these babies. So we need clean oil, whichever oil it is. I think each area has got its own oil base. We used to say a lot that olive oil is the best for the skin. However, I do believe that there are now challenges, and somehow we are now percolating to a group of mixed oils or coconut oil, whatever it is. I think it depends on the region, but we need to do it gently. That is number one, to be used as touch stimulation and not as a rubefacient. And hygiene should be taken into consideration.
Okay, all right. Well, let's move over to the toddlers and the preschool age, which is basically 1 to 5 years. One of the key issues, Dr. Sibal, and you're probably in the heart of it, is the rise in respiratory illnesses which have taken place in children within this age group especially, and that's taken place probably post-COVID-19. There's been a sudden surge. How much of it would you attribute to COVID-19 and children now getting exposed to the environment? And how much is it due to environmental factors such as pollution?
Well, I think it's more about pollution than anything else. Of course, there's a group of children where they have a higher incidence of reactive airway disease. There's a history of asthma, allergy in the family, and that predisposes these children to get more attacks of respiratory symptoms. But that said, what we are seeing is the environmental pollution that's contributing to these little boys and girls really getting more frequent exacerbations of reactive airway disease if they have one underlying condition, or just going on when the AQ is very high. We encourage them not to go out. There's very limited cycles within the day. Usually the afternoon when these kids can go out, we encourage them not to play. We encourage them not to participate in outdoor activities because the fact that they're getting in so much of these pollutants into their young immature lungs, and the impact on young lungs is way more because they get greater exposure because of the way the respiratory system is in young children, and it matures over a period of time. And it's really, really sad that in certain parts of the country, during Diwali, where the pollution levels are very high, then the winter sets in, and because of the wind direction, because of crop burning, because of extra, pollution due to vehicles, because of construction activities, numerous reasons why, we are seeing more pollution than we should. And that is really responsible for the increasing incidence of respiratory problems. I think COVID came with its own set of problems, but I don't think we can attribute the increased incidence of respiratory illnesses to COVID.
Children are either using steroids, nebulizers, inhalers, sprays to tackle all of this. What is the best way to tackle it, and why is this taking place?
So I'll answer the second question first. Why is it taking place? Because parents are impatient. They consider that cure has to be instant, which doesn't happen. Any standard viral illness, which is what is the commonest reason why children have respiratory illnesses rather than bacterial, especially in the urban population now, when nutrition is not a huge challenge, still a challenge on under or overnourishment, but still not a challenge. We see that it takes 3 to 5 days of any viral fever to settle down. There is no specific treatment for viral illnesses. So, good hydration, give as much good food to eat, keep the place clean, get the fever under control, but it doesn't have to be below 98 or something. Even keeping it up to 100 is sufficient as long as the child is not uncomfortable, and making sure that we are not missing out on any other non viral cause of fever would be the base of care. But because the parents go to the doctors, no, we need to have an immediate cure. We started medicine yesterday, but today it's not working. That will not work. We're just controlling the symptoms. We are not treating the cause at all. So from that point of view, then we start with saline or plain water nebulization, or worse comes to us, my child is wheezing. So every parent nowadays becomes a doctor, little realizing that conducted sounds in the upper airway and wheezing down in the chest are two different things altogether. But because the doctor is then helpless, saying, okay, you're saying it's wheezing, take a nap, take a steroid nap. So unfortunately, the pressure itself of the parents induces the pediatrician to go down the pathway, which is definitely not recommended.
What do you recommend on the same topic about antibiotics and giving antibiotics to children? How often?
Antibiotics are a very big stigmata actually in medical practice. Forget about pediatrics in any age group. And I think our use and overuse of antibiotics has led us to a situation where it's difficult to even discover and present a new antibiotic in 1 year. If you look at the graph, we used to have 20 to 30 antibiotics being discovered every year. It has petered down to one antibiotic every 5 to 7 years now, which shows that the resistance has increased because we have overused our antibiotics. So definitely, I think one of the rectifications is we should not use antibiotics indiscriminately. There has to be a reason. There has to be a proof that we are dealing with a bacterial infection, and the appropriate antibiotic needs to be used. The challenge there comes in is that you need time, because you need to get the culture sorted out, you need to find out other blood tests, which parents may or may not be willing for the same. So as a last ditch effort, you put in 3 days of antibiotics, overall culminating into a lot of antibiotic resistance and a disastrous endpoint to this.
Well, now talking about that age group of 6 to 12-year-olds, one of the key issues which seem to be coming up is obesity, like you mentioned. And Delhi also seems to have a peculiar problem of obesity. There was a recent survey which was done, which indicated that around at least 40% of children were obese or overweight. Why is that?
So, we at Apollo had done a study, and this was pre-COVID. We looked at about 5,643 school kids in the age group of 5 to 10 in South Delhi schools, and we'd found 15% of them were overweight and 4.9% were obese. We then looked at a subgroup of school children. We looked at another cohort of about 960 kids, and we found, we specifically looked for fatty livers in them. We did ultrasounds, we did blood tests, and we found that about 19% of those who were normal weight had fatty livers, and a huge 45% of those who were overweight had fatty livers. In that, the ultrasound looked fatty, showed a fatty liver, and their liver tests were abnormal. Now, there are multiple factors. We also then looked at another study. We tried to figure out what is it that was going wrong. And, parents are pretty categorical that they feed their kids right, but they have absolutely no idea what really goes into their kids at school. There's a lot of sharing that happens. Unhealthy food goes in. There are lots of snacks. There are these canteens where you have canned drinks, you have fruit juices, which have a lot of sugar. You have samosas and kachoris and a whole lot of fat-laden stuff that kids consume. You have a whole lot of crisps and packaged kind of snacks that kids consume, and parents don't really know. The other thing that COVID, and if we were to do the study now, I'm sure that the incidence of obesity will be higher. What COVID did was totally messed up with the schedule.
Sure.
We also had kids eating a lot more, no exercise. And so we are really dealing with a very serious problem of obesity, which is going to have an impact on their blood pressure, their lipid profiles, who can contribute to increased incidence of heart disease as they get older, issues with managing their sugar poorly, and of course, body image, extremely important these days. So much peer pressure on body image and, body shaming because of being overweight.
Well, 93% of children, according to statistics, eat packaged food more than once a week. How big a problem is junk food today?
Yeah, 42% obesity. That's a big problem. I don't think there's any other illness in childhood which is of this magnanimity. So 42% is huge, and I think packaged food or junk food contributes significantly to this. The problem with junk food is that it's bad. The release phenomenon from the parents is easily available, and it's even in the rural areas now it is being taken up because it's economical. 10 rupees.
So what's your advice on it?
Use home cooked food. Try to replace it. You don't use it as a bribe. Don't use it as a replacement for regular food. I think that's very important. My only advice in diet would be, at the end of the day, would be make sure that the child eats with the family, not alone, which is definitely a good controlling factor, because everyone's not going to eat the packaged food.
Correct.
So it inculcates a habit in them.
So how do you reverse it? What do you tell patients who come to you who are obese or overweight? What do you tell them to do?
This has to be handled very delicately, because we can have these kids go off in the other direction with feeling really bad about their body image. So you have to basically get a buy-in with the entire family. And as we always say that if it's only the child who's being asked to make lifestyle changes in terms of diet and exercise, it's not going to work. The family has to change. We have families where the parents are very overweight, but they're only bothered about the child's being the weight status, and they keep eating stuff which is unhealthy. They don't exercise. They expect the kid to exercise. They expect the kid to be very disciplined. It just falls apart in a few weeks. So it's about a buy-in from all family members, a recognition that there's a problem and that a solution can be found. And a solution means the family working together. It means getting your diet right, cutting down on carbohydrates, cutting down on fat, regulated meals, regular meal times, absolute no to junk food. And I don't really understand why people feel it's okay to have junk food once during a week. Well, what's not good for 6 days is also not good for the 7th day. It also means regulated exercise, 40 to 45 minutes, either skipping, running, jogging, whatever the kid is interested in, at least 6 days a week. Parents must also be a part of that exercise program.
All right, now for the 13 to 18-year-old category, that's the delicate category where there is, mental health, which is emerging to be an issue now. 30% of students, according to a survey, have anxiety. 32% had moderate to severe depression. Less than 5% sought any professional help. How severe a problem is mental health in this age group, and how does it manifest?
So mental issues, especially in teens and adolescents, is a huge issue, I'm sure. The problem is we do not know how big an issue because it's considered a severe taboo in our culture. So first of all, reaching out and making a diagnosis itself is a challenge. Many of the kids are just suppressed, saying, no, you're just misbehaving, little realizing how important a factor is considering mental health. So far, I think most of us have focused only on the physical health. That also only when we are unwell. Preventive physical well-being is something which is still catching up slowly but surely. So mental health definitely becomes a gray area where people are not able to diagnose. There are lots of illnesses like even Tourette syndrome, where a child has tics, where the parent thinks this is just attention seeking. So unless we educate our parents that, listen, we do have our share of mental illness, especially in an age where competitive nature of the whole survival, I think, is challenging. Our population is so high that for the same seat we are hitting out, and we need to do the best of the best of the best, little realizing what effect it may have on the child's mental status. So definitely there are lots of issues over there. We need to pick them up. We need to educate the parents, and we need to get them to open up and understand and accept that there are issues over here.
Okay. Is competition in school also weighing on children?
Oh, 100%. I mean, there's a very beautiful song, I think, in Three Idiots, isn't it? Yeah, first aaye to ghadi, nahi to chhadi. So that is displaying our competitive nature itself. As I said,
What's your advice to parents also?
pull back. My advice, which is not going to be easy, I doubt if people are going to take it, is just pull back. Think of, at my time, there were only four qualifications: doctor, lawyer, Indian chief. So doctor, lawyer, engineer, and a CA. Those are the four lines. But today, I think along with the competition, we also realize there's so many alternatives to a career. And I think we need to start exploring those.
How big an issue is social media for teens this age? How many probably even need counseling?
Well, I don't think it's about teens now. It's a problem right through childhood. I mean, you have 4, 5 year olds who on the phone incessantly. Their eyesight is getting impacted. The Indian Academy of Pediatrics, American Academy of Pediatrics, just had no more than 1 hour of screen time a day. For 2 to 5 year olds, and we see that is nowhere near the ground reality. Also, COVID contributed to this when schools started to go online. And of course, there was no option. These kids got used to, being on their laptops and tablets and their phones. So now it's very hard for them to go off. And, I sometimes see parents where they come in and they say, hey, listen, my kid is so smart, 2 year old knows how to work a tablet. And I say, you're deeply going to regret this 5 years down the road, because your child's going to be addicted to social media and going to be addicted to the device, and you're going to really struggle, and you are the one who introduced the device to the child. There has to be some amount of control in terms of parental oversight in terms of social media, what they do, where are they spending their time. And it all boils down to building a healthy relationship with your children, and that's really a part of the central to the book I wrote, Is Your Child Ready to Face the World? Because if you don't have a communication channel with your kids at a very young age, that communication channel is not suddenly going to come alive when they're teenagers.